Okay, good morning. Let's have a class today. Sorry for the delay, and we will talk about sexual transmitted disease, and we will end up this section talk about antibiotics. So, STD, sexual transmitted disease, overall. There is roughly 300 million cases in the world. So, it is a severe public health issue. Now, the survey said there is 95% of the time is from male to female, going through the sexual activity, obviously. And the more frequency, which is in 50 to 30-year age group. And we want to say something about all sexual transmitted disease from the science standpoint. Number one, there is no vaccine for that. Let's say you have a syphilis, you have a gonorrhea. We don't have developed any of the vaccine for that, so you can prevent. Or you can say you take the vaccine, you can do whatever you like. So there's no vaccine for that. Second, there is no memory of immune, or we say immune memorization. So the idea is that if you have syphilis, you get a gonorrhea, you recover, that does not mean you will be safe the rest of your life, or safe for a certain period of time. There's no immune for that. The third thing usually is challenge. There is about 30% of that is asymptomatic. Which means they did not show any of the symptoms, they have the problem. And if you continue to do sexual activity, of course, you will have trouble. Number four, there is a debate in the science area. This is more of a science issue versus social issue. So this ends up with our extra points for the AEM 341 lecture. In our final exam, before that, I will posted an essay question correlated to gonorrhea. We'll ask you to write a 300-word essay related to sexual transmitted disease. It's a debate question. Is it a science problem or it is a social issue? It is a medical science issue or it is a science issue? Because some people say in the science area you should do vaccine, you should have an effective drug. And some people say education is more important for prevent sexual transmitted disease. So this will be a very good topic, and as an undergraduate, it is also possibly a risk group, and this is a good education by yourself. So we'll offer you, I used to do 25 extra points in the final exam related to that topic, and the detail we'll post it out later. Okay, we want to talk about is two typical sexual transmitted disease today. Number one is Neisseria gonorrhea. So I want to make sure the spelling is correct, so wait for me a little bit because I was end up with a meeting. So let me wait a second. Okay, that's called gonorrhea. Okay, Neisseria gonorrhea. So first of all, this bacteria is gram-negative, rod-shaped Coccobacillus. This is same thing as Neisseria meningitis. This pathogen is a fastidious bacteria. So what this means, on the clinical area, we have three agar: McConkey agar, blood agar, and chocolate agar. And this bacteria does not grow on McConkey agar, does not grow on blood agar, is only on chocolate agar. This is even a modified chocolate agar. Is modified cell modding medium. Okay, it's a fastidious bacteria. And there is very typical biochemical reaction. It is oxidase test positive. We will do this in the lab later on. Basically, is a purple color after using oxidase reagent. Okay, so that's a basic information. Now, the gonorrhea, a typical symptom in male, is you have a pus come out from the penis. It's urethral discharge. It's a very typical picture. And we also going to show you the picture is, the gonorrhea, you see the coffee bean shape, gram-negative, surrounded with white blood cell, and it could also cause for the newborn baby. So what happened is when the baby comes out, there is conjunctiveness of those eyes, and you maybe think about it's a skin disease, but actually it is a sexually transmitted disease from the pregnant woman to the newborn. So I always talk to people, when you have anything happen to the eyes, be careful about that. It may not be a skin infection, it could be something else. So that's important that we want to talk. This passage itself, it's very susceptible to stress environment, including like UV light, like heat, all these stress environments. And also, it's very effective to using antibiotics to do. Well, certainly they're going to develop antibiotic resistance. That's another issue we can talk about later on Thursday. So that's, now we want to talk about something is that in the male and the female, the diagnosis is different. So if I have a male patient, we will get is basically is a pus from the penis. Of course, you have something else. It could be accompanied with prostatitis. Could be. It may be difficult to pee. You have a burning during the peeling. So we got the pus. We are going to do is gram stain. If the gram stain, we find it's gram-negative large Coccobacillus. We also call it a gram-negative diprococcal. Then, this tells you something. Second, this will be streak plating onto modified cell multimedia, which is a modified chocolate agar, and you will see a very typical, a pushable colony. It is a pushable colony. So this will be some typical symptoms for the male. Now for the female, what happened? We don't do gram stain. We skip that. Why? Because the female at the vagina tract, there is a lot of the normal bacteria. For example, lactobacillus. There is a protection defense system. If you do the gram stem, it will be positive results. So we skip this one. We directly get vagina tract discharge, go to modify the cyanotic media, we're looking for the possible colony. So from the colony, we further to do the identification. Now for the female, of course, you have a board in pen, you have a urethral discharge, and you also have on-period bleeding. So these are like the typical symptoms. And you will see there is an infection comes out, usually is 10 to 21 days after you see the vagina discharge. And we also want to say this pathogen is also invasive. It's not staying in one place, so it could be involved in the joints, heart, and throat, has a disseminated gonorrheal infection. Okay? So the treatment is pretty routine. We're doing the antibiotic therapy, and the diagnosis including gram stem, using DNA probe test, colony oxidase test, we already mentioned all these, and prevent. Like we said, there is no like a vaccine, so public education and diagnose treatment with asymptomatic individuals, the condom use, it is all important. So like we say here, about a couple of dots is talk about medical science treatments. The last one is more talk about is the social science, is about like education. Okay, so this is the first one. The second one is a big topic. We talk about syphilis. And before we talk about syphilis, we want to go review what we talked about before. Various group of the special bacteria, we call it is spiral sheet. Spiral sheet, we mentioned a couple of times before, it is a special bacteria. Okay, it is a special bacteria. It is, what happened is, the morphology looks like this. Asexual filament. And it also has endoflagella for movement. And it is obligate parasite. It is an obligate parasite. What this means, it needs a host. And when they come to the body, they come to cuts, bites, and abrasions. So this ends up with a very easy diagnosed tool we mentioned in our exam 1 in the microscope part. Because it have some difficult the different characteristics compared to other bacteria, we cannot do the gram stem. So what we do? We're using dark field microscope to do the diagnosis. And we have a block underneath the condenser, so the light going through the condenser is perpendicular. And we can see the background is dark and the specimen is showed up. Okay, so that's typical spiral sheets. Then we will talk about the spiral sheets we mentioned in our lecture 1, have a 3-1, which is syphilis, treponema pallidum, Borrelia burgdorferi is Lyme disease and the leptospira interrogans. So we want to talk about the syphilis first. So syphilis. This caused by the pathogen. The name is Treponema pallidum. So Treponema pallidum. Okay, this infection has multiple stages. The first thing what happened, in the penis, there is a red ulcer. That's what happened. This stage is very early. It took about 2 to 5 weeks. And we call it Chancre. It's a French name. Now, of course, because it's a primary stage. Then the second stage, what happened is if you have a body here, this body will have the whole muscular rash. And this have another French name called guma. Now, what's the problem for that? You can see that's a chancre is on the top, the guma is there. What happened is, you from chancre to guma, this ulcer could disappear. Then this brings people to confusion. Because they think the sexually transmitted disease is already being solved. Okay, how are we going to do? I already recovered. Why do I still have the issue? That gives people a very, I would say, a very false impression. And the sexually transmitted person, they could still continue to do sexual activity and will cause more problems. Now, in the last stage, that could take about 5 months to 30 years, even the lifelong time, will cause neurological or cardiovascular symptoms. So this is basically what happened for the 3 stages of the syphilis. Now, there's one more thing we also want to talk is the same thing as gonorrhea. The syphilis could also end up with congenital syphilis, which is acquired from the utero, which is from the pregnant woman to the newborn baby, is a congenital syphilis. Okay, so, and the syphilis, it is the #1 sexually transmitted disease in a long time history. In the Eastern Asia, including China, Vietnam, all those areas, it has been recorded about more than maybe 2,000 or 3,000 years. So that's a #1 transmitted disease in the world. And this is what happened is for the treatment, nothing really special. At the early stage, they could use antibiotic therapy, but later stage, you cannot do anything if it's very invasive. And we also want to mention, once the guma happens, it may be the symptom is disappear a little bit. It could be asymptomatic, and people carry these parasites the rest of their life. It also could be. Okay, so it really depends on different type of the person. Okay, Lyme disease. This is a Lyme disease. Is another big topic. There's an interesting topic we want to say. So Lyme disease. Okay, first of all, this happened in Lyme County, Connecticut. This is back in 1970s. The thing happened, what the symptoms happen is people doing aquatic actions or deep ocean marine, like fishing, they find on their arm their target shape rash on arm skin. It's like that. You can see the picture there. The target rash arm. And the scientist, Dr. Bergdorf at Montana State University in later 1970s, like 1979, find the pathogen caused Lyme disease is Borrelia. In order to remind you, we call it Borrelia burgdorferi. So that's what the name comes out. Now, Borrelia burgdorferi, same as the other spirochetes, we mentioned it's a parasite. It's an obligate parasite. They need a host. And there's a multiple host for that. And when you look at the picture, it looks like it's a 2-year program. At the beginning, it's a larvae. Then the larvae generate eggs, find the mice. Then the larvae comes out and go to the human being, and the mice eating the fecal samples. And at the end, the final host is the deer. So there is a multiple host there. Then how are we going to do the prevention? We certainly cannot cure the deer. And it's difficult to catch the mice. Then what's left is isodex ticks. So the isodex ticks control is very important to prevent Borrelia burgdorferi. And that's the ticks only thing we could do. And because compared to the others, it's more reasonable to do the treatment or to do the prevention. So you can see here serological testing using ELISA Western blot, isolation of spiral sheets, detection of the DNA, use PCR methods. We can